Do you suffer from back pain? 50% of what we treat in physical therapy is related to back pain issues. Hi, I'm Dr. Steve Ryland, clinic owner and physical therapist. I've been in this business for over 29 years, and like I said, most of the majority of what we treat is back and neck pain. Now, when we talk about back pain, that can be pretty generic. For today's educational purposes, we're going to talk about the lumbar spine. So if we look at our spine model here, the lumbar spine is the last 5 vertebrae of your low back before it comes into what we call your sacrum and then in your coccyx. So for today's purposes, we're going to talk about lumbar back pain. Back pain can be caused by several different issues. One of them could be musculoskeletal. Basically, you bend over incorrectly, you reach for something incorrectly, your muscles go into spasm, they tighten up, that pain really locks in, and for a couple of days, you're having a real hard time getting out of bed, getting out of a chair, moving around, etc. That's usually due to muscle spasms. And then it can get more complicated where you run into actual disc issues, because what happens in the spine is we have a vertebrae, which as you can see is the bone, and then you have the disc, which is in between the 2 vertebrae. That disc, the outer 1/3 is what we call annular fibers or protein fibers, and the inner 2/3 is like a jelly material, like a jello. And what happens, just like the tread of a tire, your disc can wear out over time, and that's usually due to incorrect posture. Sitting in a slump position, forward bending repetitively. What happens over time is that outer 1/3 of those fibers will start to get little micro tears. Then all it takes is something like a sneeze, a cough, moving incorrectly. That disc will tear. The contents of that disc, like we talked about, that jello material, usually will go shooting out the backside. It doesn't go directly back. It'll either go to the right or left side. And then you have these little nerve roots, these little nerves that come out. Your spinal cord runs all the way down your spinal column. And at each level, you have a nerve root that comes off. And then those nerve roots go to form the nerves that go down the leg. So when we have patients that come in that usually have nerve indicated pain, it usually is progressing down the leg. It could be going into the buttock, it could be going into the back of the leg, it could be going down the side of the leg into the toes. We've even had patients that have walked in and all they've said is, I'm numb on the outside of my foot. My little toe is numb. And that's coming from their back. And we have to explain to them, that the brain sends out signals, the signals go down the nerves then innervate those muscles, so you'll get muscle spasms. And if it's really compressed, then you'll get that numbness and tingling, which is usually not a good thing. Usually when we say numbness and tingling is involved, they have a little bit more complicated case. Now the good news is, when it comes to back pain, it's all treatable with physical therapy. You do not have to resort to surgery. You do not have to resort to injections. The key is to get into physical therapy as soon as possible. The average person waits 6 to 8 months before going to physical therapy. There's that old approach, well, it's just going to get better over time. So what do people do? They take some Aleve, they take some Motrin, they take some Tylenol. They're hoping that in a few days it goes better. Unfortunately, if you don't fix the underlying condition, which is usually posture and body mechanics, you're going to continue to re-aggravate it, especially once the disc gets involved. So that's where you need to pick up the phone and call your physical therapist. And again, like I've said in some of my other videos, we do have now direct access in all 50 states. You can pick up the phone. In most cases, you do not need a referral. You come to a physical therapist, you do not need an MRI. In fact, most insurance companies are now requiring that you go to physical therapy for so many days before they'll even authorize an MRI. Now, you can go to your doctor and get an x-ray, but what's that x-ray going to show? It's basically going to show the bone. It's not going to tell us anything that we don't already know after performing a thorough physical examination of the patient. So we're trained to do that. We are trained. We are movement experts. We put you through a series of tests. So let's say for today's educational purposes, we've done some of those tests. We determined that she's got a little bit of arthritis going on in her low back, just degeneration, or what we call stenosis of the spine. The discs have degenerated over time, may have a little bit of bulging going on in there, but she's got a little bit of low back pain that may be shooting into the buttocks. All of this is treated with physical therapy. And what I'm going to show you today, 3 of the most common exercises that you can do pre-back pain. These are to prevent you from having back issues, and also post. If you have some type of issue that we just talked about, whether it be muscle spasms, whether it be disc involvement, or something that's going on in the low back, 3 of the most common exercises that can really help you improve, get stronger, etc. So that way, you know, down the road, that's the key thing, is we do not want this to progress. We do not want it to get worse to where you end up in a situation where you can't get out of a chair, you can't get out of bed, you're basically immobile. That leads to lots of other medical conditions. So let's start off with some 3 simple exercises. And the first one is what we call a pelvic tilt. Let me put our little spine model down here. All right, a pelvic tilt, all you're gonna be doing in a supine, or what we call laying on your back position, which is what we call supine in the medical world, all you're gonna do is you're gonna gently contract your abdominal muscles, and you're gonna try to push your belly button down into the table. So you're just, and a lot of people when they do this exercise, they feel like they really need to tighten up and they try to lift their bottom up off the table. You don't need to do that. All you're doing is just contracting those abdominal muscles nice and slow. It tips the pelvis in a posterior position. That's why we call it a pelvic tilt. You're tilting that pelvis in a posterior position. You're gonna hold that for about 3 to 5 seconds, and then you're gonna relax. And the key while you're doing these exercises, keep breathing. You know, do some deep breathing exercises while you're doing these, but don't stop breathing. You're gonna do about 10 of those, 15, 20, you know, or gradually you're gonna build up. You're gonna do 2 to 3 sets. These are really good to do in the morning before you get out of bed to start off your day. So again, just a nice gentle pelvic tilt, pushing that belly button down, you're sucking in your abdominal muscles, and basically what we're feeling for is for that back to flatten out into that table. So that's a pelvic tilt. The second one is what we call a bent knee fallout. And this one is actually working your abdominal muscles. You know, you have your back stabilizers, which are your postural muscles, all the muscles that run on the back side along your spinal column. Those are basically what we call your paraspinal muscles or your back muscles. And then you have the front muscles, which are the abdominal muscles, which are your postural stabilizers. So with this exercise, we're actually going to fix those postural muscles in the back, those stabilizers, by doing that pelvic tilt again. So you're going to gently do that pelvic tilt. While you're holding that pelvic tilt, you're going to allow one leg to just gently drop off to the side. Now the key with doing this exercise, go slow. There's no need to rush it. Then you're going to just pull that leg back up into the starting position, okay? Then you're going to relax the tilt. So again, pelvic tilt, hold. As that leg drops off, what you're going to feel, if you have weak, this is for the transverse abdominis muscle. It's one of the abdominal muscles that stabilizes the back. You're going to feel your back start to arch off the table. If your back starts to arch off the table, you want to stop the exercise at that point. Your muscles aren't strong enough to allow you to continue that motion. So again, pelvic tilt, let the leg drop out to the side, stop, back up nice and slow. You're going to do 10 on the right, 10 on the left. And you're going to do like 2 sets of that. So 10 and 10. And again, it takes some time to learn these exercises, so don't force it. Don't push it. If you're starting to feel like you drop that leg off and your back's starting to arch, just stop right there and bring the leg back up, okay? So again, bent knee fallout. Pelvic tilt, 1, 2, bent knee fallout. And then something you can do just to strengthen, stretch the back muscles is what we call a double knee to chest or a single knee to chest. If you're in a lot of pain, you probably don't want to do the double knee chest because that incorporates lifting both knees up at the same time towards your chest. Go ahead and bring both up. If that's comfortable, you never want to hold your hand on the front side of the knee because that's pushing pressure on the knee. We don't want to cause knee problems. You're always going to hold back behind the knee. You're going to bring that comfortably up into a stretch. You'll feel your back muscles, you'll feel your buttock muscles stretching. You're going to hold that for about 20 to 30 seconds. Then you're going to gradually let that back out. Now, as you're letting it back out, your abdominal muscles are going to be kind of kicking in to support that low back. If you start to get spasms because of that, do 1 leg at a time instead of 2. So you're just going to do 1 leg, do the right leg first, again holding 20 to 30 seconds, let it back out. You can do 5 on the right, you can do 5 on the left, or if you're at that point where it's not too uncomfortable, you can do both legs at the same time, 20, 30-second hold, do about 5 of those. These 3 exercises, the pelvic tilt, the bent knee fallout, and that either single leg or double leg chest stretch, you can do first thing in the morning before you go to bed. And you should do it every morning. Every morning you should be doing these exercises to help stabilize that back, get that back nice and healthy, get those abdominal muscles kicking in so that they're stabilizing. And those are the 3 top exercises that I would recommend for a patient who either is trying to avoid back situations or currently has a back situation They're not in acute pain. They're at the point where they can start doing some gentle exercises, and these three are important. Now, what leads to back pain? Again, we talked about poor posture and body mechanics. You know, your knees will last a lot longer than your back will. So we should always be bending from the knees, bending down to pick things up. Don't forward bend. You don't want to be reaching forward and lifting things. It puts a tremendous amount of pressure down your back. The other thing that we do is getting out of bed in the morning. You know, we get out of bed hopefully 365 days a year. One of the things we do, what I call, most people, we call it the Undertaker. You're sitting straight up in bed. Well, what you're doing when you're doing that is you're putting all your back muscles on a tightened position. You're already setting them up for that poor contraction during the course of the day. We call it log rolling. You always want to log roll, and I teach all of my patients, whether it's a knee patient, an ankle patient, a back patient, a neck patient, I always teach them because I say, you know what? We've talked today, we've done your evaluation. From this day forward, you're going to do a log roll every time you go to get out of bed. If you're a napper and you take a nap in the afternoon, you're laying down in bed, same thing. Whenever you get out of bed, you want to do this log roll, and it's very simple. So let's say you're in a sleeping position, your legs are out straight, you're waking up, whether you're on your side or on your back. Do not sleep on your stomach. Sleeping on your stomach puts you in a very awkward position, not healthy for the neck, not healthy for the back. If you're a stomach sleeper, I want you to start working now on trying not to be a stomach sleeper. Side or back is best. All right, so what you're gonna do, let's say you're waking up, you're on your back. What you're gonna do, first thing you're gonna do is bend both knees up, okay? And for educational purpose today, we're gonna say you get up on the left side of the bed. What you're gonna do is you're gonna roll onto your side. Gently roll on the side, and then what you're gonna do, like a log, you're gonna do one swing at a time. So what you're gonna do is just swing those legs off and at the same time push up. Now what that does, it takes all these posture muscles out of the picture. You're not putting a tremendous amount of strain on those posture muscles. So that's the way to properly get out of bed every day. So again, rephrasing, pelvic tilt, single leg drop off, single or double knee chest stretch, and always log roll when you get out of bed. So these are 3 successful tips. I hope that you got something out of this video. If you're in a position where you're having back pain and you really want to consult a physical therapist, pick up the phone and call your local physical therapist and get in right away, because they will do a thorough evaluation on you. They'll be able to tell you what the source of your pain is, and they'll be able to walk you through steps of getting better, and most importantly, prevent it from getting worse and prevent it from recurring in the future. I'm Dr. Steve Ryland, physical therapist. Thanks for joining us today. Don't forget to go onto our website, aligntherapy.org. Check out some of our recommended products, where we have recommended products for back pain, for neck pain, etc. Also, don't forget to like this video, share this video if you got something out of it, and hit our subscribe button on our YouTube channel. We appreciate you tuning in today. Hope you have a great day.